Bismillahirrahmanirrahim. Thyroid disorders in pregnancy. First of all, you should recall what is happening with thyroid gland in the pregnancy. So here is thyroid gland. So you know better it's stimulated by anterior pituitary, and then the release of T3 and T4 in response to TSH. So then they send feedback, and there are T3 and T4, which is increasing the metabolism, growth, and development. So what is happening in the pregnancy? There is enlargement of size. This is due to increase the colloidal deposition, and there is a decreased level of plasma iodine in the pregnancy. This is due to increased renal excretion. Okay, so that's why there is enlargement in the size of thyroid. And there is total T4 and T3 is increasing. This is not due to TSH. This is due to the thyroxine binding globulin, which is stimulated due to estrogen. So total T4 and T3 is going to increase, but not free T3-4, which is remain unchanged. TSH and free T3 and T4 level is unchanged because there is not increase in the thyroid gland activity. So this is due to estrogen. Okay. So enlargement in the size of the thyroid, there is increased T4, T3, and increase thyroxine binding globulin. Okay. So here is summary of what is happening in the pregnancy in the thyroid. The increase in thyroid size, total T3, T4, thyroid binding globulin. And what is unchanged? Free thyroxine index, TSH, TRH, and free T3, T4. These are unchanged. Okay. What are thyroid diseases in the pregnancy? So number one is physiological goiter. The second is hyperthyroidism, and the other is the hypothyroidism. Physiological goiter. This is due to increased blood supply, increased renal excretion. Then there is decrease in iodine, which increase the total T3, T4. Sometimes it causes a physiological goiter. There is increase the thyroid gland. Okay. So, but free T3 and T4 are unchanged due to TB because this is increased due to thyroxine binding globulin. Okay, so we consider it a physiological goiter. It's not a pathological. Okay, so hyperthyroidism. There are different cause of hyperthyroidism, but one of the most important and common cause, which in the pregnancy, is the Graves' disease. Okay, this is autoimmune disease where there is thyroid stimulating immunoglobulin are present, which act like a TSH. So they actually stimulate the thyroid, which cause the hyperthyroidism in T3 and T4 level are increasing, and while TSH is level is going down. Okay. The other cause is the toxic nodular goiter or plumbers. So there is a thyroid nodule which is actually producing T3 and T4. This is independent of the hypothalamus, the interpituitary actions. Okay, so this is associated with the associated with the thyroid nodule, which is actually producing T3 and T4. Okay, and the other cause and the mole, additive form mole. So where there is a high level of beta HCG, beta HCG actually can increase the TSH level, so increase T3 and T4. Why this is increasing? Because there is alpha subunit, which is common in if you recall your physiology. Alpha, there is alpha subunit, there is beta subunit. Alpha subunit is common in HCG, TSH, FSH, and LH. If you recall here, so there is alpha subunit, there is a beta subunit. Alpha subunit is common in LH, FSH, TSH, and beta subunit specify the HCG or other the FSH, LH, and TSH. Okay, so you can see here is a alpha subunit which is common, and beta TSH make the beta the TSH, and beta subunit make the FSH, beta subunit make the LH, beta subunit HCG. So alpha subunit is common. So that's why increase in the beta HCG can stimulate the act as stimulate the TSH, which increase the T3 and T4. Okay. So what are signs and symptoms? Of course, you know already what are signs and symptoms in the hyperthyroid: weakness, nervousness, diarrhea, weight loss, heat intolerance, emotional instability, immunorrhea, and signs: goiter, warm skin, eyes tear, the exophthalmos. This is exophthalmos, you know better. And there is brick reflex, tremor, tachycardia. So these are the symptoms which commonly you see in the hyperthyroidism. So what you should do? You should treat this condition. How you can treat hyperthyroidism by giving PTU, especially in the first trimester. You go for the PTU because there is a because the methimazole they cause some problem, so it crosses the placenta because PTU is the mostly 90% is bound in the bone fall, so it can limited PTU can cross the placenta, so there is a limited side effect. But methimazole you can give in the later the trimester, second and third, but in the first trimester you prefer the PTU. Okay, and the other you should give a limited drug of PTU. So to decrease these drug PTU or methimazole, you can add the beta blocker, steroid, or iodine. Or in the severe cases, you must add, but in the mild condition, to decrease the drug of PTU because they can somehow they can cross the placenta, so you can add these drug. Okay, plus or minus. And thyroidectomy, if there is no response to PTU, so medical therapy is failed, then you go for thyroidectomy. But never, never, never give radioactive iodine. Never give radioactive because it will destroy the fetal thyroid. Okay, so it destroy complete destruction of fetal thyroid. So that's why radioactive iodine is contraindicated in the hyperthyroidism in pregnant women. Okay, so but if you untreat hyper, there will be a poor outcome. I mean, there is preeclampsia, preterm, or low birth weight. So a lot of poor outcome can occur. But if there is thyroid storm, then there is thyroid storm, mean excessive T3 and T4. This is a life-threatening condition. Okay. So if you look at the proper thyroid, there is some advantages, disadvantages. You can compare it. Safest in the pregnancy because highly bound with the protein, highly plasma protein binding, so limited can cross to placenta. So it inhibits the. This is the mechanism of actually the pharmacology of the profile thiazuracil. And the disadvantages, it can cause immunological hepatitis, common macular rash, and ANCA positive vasculitis. Okay, so and agranulocytis in the grave disease. So these are some side effects associated with the propyl uracil. So you should use in the first trimester, and because it's harmful to liver. So in the later you can change with the methimazole, but there is some side effect associated with the methimazole. One of important side effect is the apalasia cutis of succulae. Mean there is absence of skin over the succulae. You can see here there is absence of succulae. This is with the methimazole. In the first case which is reported, it was in the 1972, which is apalasia cutis of succulae. This side effect was associated with the methimazole. So once daily regimen, it decrease the side effect. So you should consider the advantages and disadvantages. Then you go for the PTU or the methimazole. Okay, so in the Europe, in the South America, European, and Asia, methimazole is used, while in the North America, the PTU is mostly used. Okay. Hypothyroidism mean T3, T4 low and TSH is high. Okay. Most commonly the Hashimoto thyroiditis, which is autoimmune, and there is a rare myxedema, but the most common is Hashimoto thyroiditis. And there is heterogenic, mean this is due to radioactive iodine 131, means if someone has used the radioactive iodine or subtotal thyroidectomy, so this can cause the hypothyroidism. And drug induced mean there's iodine deficiency or lithium or antithyroid drug which can cause a hypothyroidism. Okay, signs symptom you know better: weakness, fatigue, cold, intolerance, constipation, opposite to the hyperthyroidism, hair loss, weight gain, amenorrhea, and signs: dry skin, periorbital edema, thick tongue, decreased reflexes, hypertension, the bradycardia. So these are sign symptoms of hypothyroidism. So if you can see here is the Hashimoto, the enlarged, inflamed, hypofunctioning thyroid goiter. Okay, so treat how you can treat hypothyroidism by replacement therapy. You give the levothyroxine or L-thyroxine, which is a replacement therapy of the hypothyroidism. So if you treat this condition, that's great. If you untreated hypothyroidism, it may cause a miscarriage, stillbirth, or preterm preeclampsia. Okay, so this is the summary of the hypothyroidism, the same symptoms. Okay, here is the mnemonic mouse thyroid for the hypothyroidism and thyroidism for the hyperthyroidism same symptom. Thank you very much. Allah Hafiz.